thank you all for coming today. Really, really a pleasure to be able to be with those of you that are caring for your loved ones. My journey had been a professional caregiver until a couple of years ago when my mother-in-law came down with dementia. And I have to give a huge shout out to my husband who cared for him personally, all by himself, in Michigan while I was here in Florida for 2 years. And he was definitely a unique caregiver. And for those gentlemen that I see here in the room, we really do admire the work that every caregiver does, but we know that male caregivers are 1 in a million, so thank you. And it's really different. I've been doing this as a career for many years. But when it hits you in your own family, it is very different. So I was asked to talk today about navigating the healthcare system. And wow, we could talk for a long time about that. But I think that there are a few things that are really important. I know you've experienced them. Sometimes people will tell me, yeah, I've experienced this, but I've never really put my finger on what the problem was or what it was really called or where to look for help with it. So that's what we're going to talk about today. So you'll hear this term probably a lot. If you haven't heard it already, you'll be hearing it in the future about care transitions. So what is a care transition? It's when a person makes a move between a healthcare practitioner or a setting because their condition is changing, their needs are changing during the course of either an acute illness, something that is suddenly coming on, might be you've got the flu, might be you've got strep throat, might be your blood pressure's up today, but normally it's fine, or something that's a chronic need. Your blood pressure is not managing well anymore, or your kidneys aren't working so well. So there's a lot of transitions that we make. And this is a perfectly good example of how complicated it can get and why. So if you're in the home, you may be receiving care at home. Typically, we think about we go to the doctor's office, we may go to an emergency room, we may be going to the hospital, but once we leave the hospital, we may not be going straight back home. Then we may be dealing with going to a skilled rehab center. We may go back home and then be having to go and get blood work done or having to get some other tests done. So there's a lot of transitions and there's a lot of management of that can be very, very difficult. So we're talking about how can we help people with this? What are those problems and what are some strategies? So that's what I just want to share with you this afternoon. So we've all got this Swiss cheese. We've all seen this picture probably. Well, look at all those holes. And if we don't get things lined up, it's not going to be a very good path that we're going to be on. If we're going to really have a smooth transition for anything, we are going to have good communication. We're going to have a system that is there to support us. We're going to have some standardized processes from the caregivers who are helping us. And we're going to have to be a part of that team. So it's not easy to get all of those holes lined up, but it can be done. One of the most important things that you can do to help navigate a system is to have your medical file and to have not only one for your loved one that you're taking care of, but each of us should really have this. So a personal medical file, and I have a handout for you that on one side it has a checklist of the kinds of things that you're going to put that file together that the ladies talked about before me. There's a lot of different things that can be and should be in it. So I just put them on that checklist for you. So think about that. But we know that we have to take our insurance card. Make sure a photo ID. If your loved one doesn't drive anymore, it doesn't have to be their current, driver's license that's a valid driver's license. It needs to be a photo ID. So like my mother-in-law, she doesn't drive anymore, but her driver's license picture from before looks like her, it identifies her. That's acceptable. Or you can get photo ID from the state. That is not a driver's license. But when you're going places with insurance now, They want that photo ID because they don't want someone to fraudulently be using someone else's insurance. A copy of that advance directive. The healthcare surrogate. Who is it? I've said that I want my daughter to be my healthcare surrogate. She needs to have that paper that says, I am the healthcare surrogate. Your doctor's office needs to have that. The hospital where you go needs to have that in your medical record file. Your living will. If you have a community do not resuscitate, keep those papers with you. Back in the corner here is Lorraine, who's one of our senior ER nurses. And she tells me all too often about the patient who comes into the emergency department who's very ill, and their loved one should say, do they have an advance directive? Do you know what their wishes are? Well, he has one. Have you talked about it? No. Do you know where it is so you can access it? It's in his safety deposit box. That doesn't help. So not only do we want people to talk about that, but if you can't come to talk about it, at least make sure that the paper that someone can read and know your wishes is somewhere where it's accessible. So really, really important. But if you're putting your little file together, have a copy of that. Have your family, your emergency contact's phone number there. When we're stressed, and somebody asks me my birth date sometimes when I'm stressed, I might stop and think, oh my God, when is my birthday? Phone numbers, really hard to, how do I get a hold of my brother Bob? Have them written down. Your pharmacy, and hopefully you're only using one pharmacy. That's really important as well. But many times, a doctor or a pharmacist in the hospital or at your doctor's office might want to contact your pharmacy and just clarify some things. Of course, your current med list. One of the things I always like to keep, to make sure I tell people is, your medication list isn't just what's prescribed. Please remember, anything you can buy over the counter, just because it's natural or holistic or doesn't require a prescription, doesn't mean that it's safe or doesn't mean that it couldn't potentially have interactions with other things. So if you're taking vitamins, minerals, supplements, that's okay. Just make sure that we know that. Because it might be working fine now, but we're going to give you something new, and that might not be such a good idea. Also, don't forget things like eye drops. A lot of people take eye drops for certain eye diseases, and they forget to tell us that. I've had patients in the hospital that, they were there a week or something, and then they're like, oh my gosh, we forgot Dad's glaucoma medicine. So those things too. The names and phone numbers of all of your doctors and what their specialties are. Your medical and surgical history list, the key things. What kind of allergies you might have, or what we call an adverse reaction to a medicine. Now, I'll give you a little hint that all of us doctors and nurses like people to know. An allergy to a medication is a serious, serious thing, causes you breathing problems, can potentially cause you to stop breathing, cause heart, kidney failure, whatever. That's a true allergy. Like we used to think of penicillin allergies. Most of us can identify with that, or a bee sting, kind of thing. An adverse reaction might be a medication. It's not going to put you in a life-threatening situation. Gives me headaches, makes me nauseous, makes me constipated, or gives me diarrhea. There's a difference. It's okay to list those things, but I'd like to have people understand that there is a difference. So, if we really need to give you a medicine that maybe hasn't reacted the best with you, but it's the only thing that we have to offer, we need to know whether you're allergic to it or whether you've had just an adverse reaction. And having that summary list from your doctor from the last couple of visits. So let's talk a little bit about the different settings that we can be in. So the outpatient setting. So when I talk about that, I'm talking about going to your doctor's office in particular. How do you know when you should seek care? Let's say you have heart failure, or you have emphysema, or something where problems come up and you're not sure, doctor, when should I be coming to see you again? Or when should I consider that this might be something I need to take care of quickly? Who should I go to? Where should I go? These are conversations that are really, really important for you to have with the doctor who manages that particular problem for you. It's also, sometimes there's communication between several physicians or other healthcare providers is going to be important. So knowing where should I go, when should I call you? So having that medical file is really nice, but we don't always carry that big thing always with us. So little pocket card, we have them from Florida Hospital. You see them in different places where you can put your medication list, your allergies, the most important things that you need to be concerned about or that you want to make sure that they know your medical problems. Get a piece of paper, write those things down and fold it up and put it in your wallet. It doesn't matter. It doesn't have to be really an official card. But have that information so that you have it when you go to the doctor, to the hospital, whatever. When we go to the hospital, oh my gosh, the kinds of things that are challenging to us in the hospital now. How many people just love the fact that their personal doctor does not go to the hospital anymore? Anybody? So we have these physicians that are known as hospitalists. And you know what? Hospitalists are great. We have to understand that this has evolved into a real specialty, for one thing, of practicing in medicine because people are so sick in a hospital. And it allows our primary doctors to have more time in the office, although it doesn't always seem like they have a lot of time. But it's not such a bad thing. What you need to be able to do is to be proactive and to be able to help them to learn as much about you or the needs of yourself or your loved one in as easy a manner as possible. And that's the kind of thing that empowering yourself, don't feel intimidated. Don't feel like, if they don't ask, they don't need to know. Be ready to communicate and don't feel like you can't talk with them or let them know. The other thing in a hospital is your nurse, the nurse that cares for you or the nurse that cares for your loved one. That nurse's job, the thing that we hold most sacred, far beyond giving you your medicine, helping you to the bathroom, making sure you're turned. What we hold most sacred is that we are there to be your advocate, okay? So talk to us. You're the caregiver. Talk to us. Ask to see the social worker if you'd like. Don't worry if you're not really able to get a hold of that doctor. He's never making rounds when I'm around. Talk to your nurse. The nurse will help you with those things. Very, very important. A hospital stay, used to be when I was a new nurse, if you had your appendix out, you were probably with me for 7 days. Now you don't even come onto the inpatient floor. You may have an outpatient surgery and be gone, or you're there overnight. The flow and the pace of a hospital stay is really fast now. And so we have to be prepared for that. And really the best way you can be prepared for that is to write down your questions, to develop that relationship with the nurse, and to make sure that you've kind of done a little homework about some of the things that you can help prepare for when you're in the hospital or to help get you back home. So one of those things in the handout that I gave you, is on the back where it says resources. There's a couple of resources listed here. One from NICH, which is Nurses Improving Care for Health System Elders, that program that I'm a part of. And NICH actually has some materials for patients and caregivers specifically. And they are wonderful information sheets and checklists. Go into the emergency room, go into the hospital. There's a great page that you could fill out if your loved one has dementia and you want to make sure that the staff kind of know these things about your loved one. And you can take that and give that to them and ask them to put that on their chart, leave it in their room so as people come and go, they can kind of know these things. So there's some great resources there. They also have, NICH has an app for your phone. So I put on there how you can get that. It's free, of course. And then there's a brochure about a guide for when you leave the hospital. So there's some nice materials that you can get access to in regards to the kinds of things to prepare yourself. So hospital-acquired infections. Most of us have known someone who's been in the hospital and who has gotten an infection. We work really, really hard to not have that happen, but it does happen. So we need to make sure that we're being diligent for ourselves and for our family members in looking, are people washing their hands? You know, is this person being kept clean? Does the environment look clean? Those kinds of things. Be proactive for yourself and for your loved ones. It's okay. It's what, you know, hold us to the standard that we need to be held to if we're not doing it. So some of these things that can happen in the hospital, that happen a lot to people, particularly with dementia. One is delirium. You get acutely confused. Confused more than you've ever been, or confused and you've never been. That's a common thing that can occur. Happens because you're sick, and it happens because you've been given a new medicine. You had anesthesia, or you're on pain medicines. But we need to figure out why you're confused and then treat the cause. So if you're finding that your loved one is more confused and you say, you know what, doctor, you know, my mom is not normally like this. If your doctor says, oh, she's just getting old, that's not acceptable, is it, Dr. Laird? When you see such change like that, we need to find out why. That's an opportunity. You can look to us to help you learn more about things like this. So we've talked about some of those solutions. Keep a pencil and pad with you. It's very important. Write down those questions. Be prepared. Have someone stay. Stay with that loved one, or have someone with your loved one as much as possible. Be there for them. Be there to oversee and be that advocate. As a caregiver, that doesn't mean it has to be you 24/7. And it also means sometimes you might want to just ask, do I need to be here? There are times when maybe you don't, okay? But pull in your team then and use that as an opportunity to make sure your loved one is safe, but not necessarily that you have to be the one awake 24/7 with them. So then we go to a skilled nursing facility. So some of our challenges there are the fact that now you got new doctors, new nurses. So guess what? That list of information, make sure they understand it. Yes, the hospital sent them some things, but it might not be all of the things that they need to know. So once again, be proactive. Take advantage of the opportunity for that therapy, for that skilled therapy. A lot of my patients are like, no, I just want to go home. Yes, you can get therapy in the home, but if the doctor feels like you need the more intensive therapy of a skilled facility, it really is to your benefit if there's no other factor that really, rules that out. And understand what it is that you need to achieve and what can it really give you. Some people think they're going to go home and be like rehab, I'll be like I was 2 years ago. Well, be realistic, but ask, what can I expect out of this? Talk about what goals you have at home. What do you want to get out of this rehab stay? It's really important. And then home sweet home. We all love getting home, but if you've been really sick, it can be pretty darn scary to get back home. All of a sudden you've had nurses and doctors and social workers and therapists all there. Your team was all there helping you. You're the caregiver. Maybe you did get to go home and sleep at night. And now you're back home and you may feel like you're on your own. Well, know that there are people that can still support you at home. And once again, don't hesitate to take advantage of getting a home care nurse in, the home care physical therapist, to help get that next step and that transition into, okay, now I can function at home piece accomplished. I often get a lot of people who don't want someone to come into their home, and it's a tricky thing. It's our personal space. We have a lot of issues why many of us don't want someone in the home with us, but it can really be a good thing. Find a trusted home, support team and take advantage of them, as well as take advantage of, resources in the community adult daycare and things like that. So it's not rocket science, rather it's good care, good communication, a lot of attention to detail, and teamwork. And all of those things put together will really bring you to a place where you feel like you're more in control of those transitions of care, and that you know where to reach out and who to support you during those resources. But the number one thing, is really doing your homework up front to set up that medical binder. Yeah, it's a little intensive at first, but once you have it and then you just keep it updated, it will serve you well. Lorraine and Maria, don't you love it when you see somebody come in with their little binder? Because when you ask them, or they're ready. They're ready with the information that we need in order to help you as well. Thank you.